Imagine being in the most excruciating pain of your life. Treatment after treatment, procedure after procedure. There's no cure and there's no hope. According to McCarthy and Toru, a terminally ill patient is defined as suffering from a fatal disease where medical treatment will not lead to restoration of health but prolongs the dying process. One woman set the stage after winning her case to be prescribed a lethal dose of medication. Her name was Kate Cheney. In 1999, she was 85 years old and then was the first American to legally commit physician-assisted suicide. She suffered from a long battle with metastatic breast cancer until it was deemed terminal. At that time, Oregon was the only state where doctors could assist with suicide for terminally ill patients. Kate wanted the opportunity to have assisted suicide as an option in the event that she was in unbearable pain or lost control of her bodily functions. Oregon Live quoted Kate saying, "If you know your time is limited, you're not afraid to die. A physician should be able to give you the means to do that." Once given the prescription, Kate then said, "I may never use it, but it's just to have the decision in my hands rather than anyone else's." Decisions are what make us feel like we have control in life. And this is especially important for those terminally ill patients who decide on physician-assisted suicide. This gives them both power and choice to decide on when their final moments are so that they can get all of their affairs in order and really live their life to the fullest. And if you're mentally competent and you have a long road of suffering ahead, it's a no-brainer that there should be a right to choose. People have the right every day to refuse life-saving treatment, so that should be the same case for physician-assisted suicide. It's the same thing. They are choosing to not prolong their life of just suffering. And it's the same thing that applies for those patients who want the option and choice for physician-assisted suicide. In a 2018 poll by Gallup, 72% of Americans voted in favor of supporting physician-assisted suicide. Those high numbers go to show that Americans don't want other Americans to suffer, and there should be laws throughout all 50 states to reflect that. Physician-assisted suicide is legal in 7 other countries, along with the 10 states here in the United States. Every country has different criteria for its eligibility, but the reasons are all the same: to take control of the end. My Death, My Decision states that between 1 and 4% of its total deaths in all of these countries are due to physician-assisted suicide. And of that 1 to 4%, 70% are due to terminally ill cancer patients. Death with Dignity is U.S. legislation in those 10 states that allows certain terminally ill patients to legally get a lethal prescription to end life on their own terms. This act works to give people the freedom and empowerment to set their own time frame. Like I said before, not everyone who gets this lethal prescription takes the medication, but just knowing that there's an option provides them some comfort in taking charge of their lives. Life is all about decisions. It shapes us and makes us who we are. Giving terminally ill patients the freedom to decide how and when they die helps them claim some control of their life. We see this in the very first case with Miss Kate Cheney, and how her prescription gave her power back in her life. And others should have the opportunity to do this as well in the other 40 states.